Nursing 335 head to toe assessment.
Hello there, how are you?
Good, how are you?
Good, my name's Carrie. I'm going to be your nurse today. I'm going to pull for privacy, and I'm also going to wash my hands.
Identify patient with 2 patient identifiers.
Can you state your name and your date of birth, please?
It's Cynthia Donaldson, January 11th, 1983.
Very good. I'm just going to double check that with your wristband.
Check for allergies.
Do you have any allergies to any medications?
No.
I'm going to check your allergy band as well. You sure do not.
Level of consciousness orientation.
All right, so I'm checking my patient, and she is alert. She is conversing with me appropriately. So you know your name, you know your date of birth. Do you know where you are?
I'm at Lourdes Hospital.
Okay, do you know what day of the week it is?
Friday,
And do you know what year it is?
2021.
It is. All right, so she's alert to person, place, time, and situation.
Student provides respect for patient and maintains a professional demeanor. Current complaints, problems, symptoms.
Okay. Are you experiencing any health problems today?
No.
Okay, very good.
Pain assessment.
Are you in any pain?
No.
Current medications.
Are you taking any prescription medications, any over-the-counters, or any herbal supplements?
Just a multivitamin.
Okay, on a daily basis?
Yep.
Very good. Does it have calcium and iron in it as well?
Calcium. I don't know about iron.
Okay, very good. It's important for women your age to have adequate sources of calcium and iron, so you may want to check that with your vitamin supplement.
Thank you.
Smoking, alcohol, drug use.
Do you smoke at all?
No.
Do you have any history of smoking?
No.
Very good. Do you drink alcohol at all?
Sometimes.
And how much alcohol on a daily basis would you say you consume?
Oh, not every day.
Not every
Just
day.
maybe once a week.
Okay, very good. And how many drinks per week would you say you take?
2?
Okay, very good. So just kind of a social drinker.
Yeah.
Excellent. Do you take any type of drugs or illegal substances at all?
No.
Very good.
Past medical history.
Do you have any acute or chronic illnesses in your medical history, any diagnoses or past hospitalizations?
No.
Okay, very good.
Past surgical history.
Have you ever had any type of surgery at all?
No.
Very good.
Past family history.
Is there anyone in your family with any type of major medical history, any acute or chronic diagnoses?
My grandma had breast cancer.
Okay, very good. Did she have to have a mastectomy?
Unfortunately, she died from it.
She died. Okay, very good. Did her oncologist report of whether it was a familial transmission at all?
I unfortunately don't know.
You do not know. Okay. Do you see a gynecologist regularly?
Yes.
Okay. And do you have yearly mammograms?
No.
You do not. Okay. Does your gynecologist recommend yearly mammograms?
She said we'll wait.
Okay. So baseline at 45. Do you do self-breast exams on a daily basis?
Not daily, but every once in a while.
Okay. So, or you should do them on a monthly basis. Do you do self-breast exams on a monthly basis?
Yes.
Okay, very good. That'll help detect any type of abnormal lumps or lesions, and if you detect any, then you should report those to your gynecologist.
Thank you.
You're welcome.
Vital signs. These have already been taken for the purpose of this video. General survey. Note patient's general appearance, body position, posture, gait, coordination, facial expressions, mood, affect, hygiene, nutritional status, speech.
Okay, so my patient is alert and oriented. She's sitting upright. She appears happy. I can see that she's animating with her eyes over her mask. She's appears clean and appropriately dressed for the situation. And her mood and affect are appropriate as well. So I'm going to have you stand up. And I'm just going to have you take a walk just halfway across the room. And then I'm going to have you turn around and come on back. And go ahead and just have a seat again. So I'm noticing that my patient has a steady gait. She's not limping. She doesn't appear to need any type of assistive devices. When she walks, her arms alternate appropriately, and there are no concerns with her gait.
Skin. Inspect and palpate for color, temperature, texture, moisture, lesions, edema, turgor, and hair distribution.
Okay, so I'm looking at my patient and it looks like her hair is evenly distributed. Her skin is appropriate for ethnicity. So I'm just going to go ahead and I'm going to check your skin. I just want to make sure that there aren't any abnormal lesions or any problems with your texture. So I'm just going to kind of palpate the musculoskeletal texture here. You're nice and warm, and I'm not seeing any abnormal lesions on your skin. And I will check it on your abdomen when we do your abdominal assessment. You're nice and warm. Very good. And I'll look at the skin on the back side when we are assessing that area of your body. Turgor. So I'm just gonna check your skin turgor here. That can be a sign of dehydration. I'm just pinching up the skin and it returns to its normal position. So your skin turgor is normal.
Edema.
So as I'm pushing on your lower legs, I'm pushing in and there isn't any remnants of my handprints going into the skin surface, so there's no persistent depressions in there, so it doesn't look like you have any type of edema in your lower extremities at all.
Head and face neurological. Facial expression and symmetry, cranial nerve 7.
Okay, so can you remove your mask for just a moment? Can you smile for me? Can you frown? Can you puff out your cheeks? And can you raise your eyebrows? Very good. So I'm looking at my patient and her facial features are completely symmetrical at rest and with animation, and everything is symmetrical bilaterally.
Inspect external eye structure, eyelids, lacrimal ducts, lashes.
Okay, so I'm taking a look at my patient and her eyelashes are evenly and fully distributed on both her upper and lower lids. Her sclera are white bilaterally. I'm looking at the lacrimal ducts and there isn't any discharge or drainage.
Vision and visual acuity, cranial nerve 2.
Okay, so I'm going to just give you a handheld card here. And we're just going to check your central vision. So what I would like you to do is just to hold this card where you would normally read, usually about 7 to 8 centimeters, and I would like you to read the lowest line possible.
Does it matter if I have contacts in?
Do you wear contacts or glasses?
I do.
Okay, very good. So we're going to assess your vision with your contacts in to make sure that they're at an appropriate prescription for you. And if we're not able to get a good reading on this, then I'll refer you back to your ophthalmologist or optometrist so they can adjust that prescription if necessary.
Okay. 426-739.
And I think that your prescription is appropriate because you have 20/20 visions, which is great.
Perla, cranial nerve 3, 4, 6, oculomotor, trochlear, and abductans.
All right, very good. So I'm just going to check your pupils, and looking at them initially, your eyes are in complete alignment. So I'm going to go ahead and just check the size of the pupils, and it looks like they're about 3 millimeters bilaterally. So I'm just going to shine a light in your eye. I want you to go ahead and look straight at me. I'm going to bring the light in to the side here to look at your pupil, and it constricts when I bring the light in on that side. I'm going to do the same thing on this side. The pupils are equal, round, react to light. When I shine the light into this eye, the pupil constricts on this side, and that's a consensual reaction. When I shine the light directly into the pupil, it had a direct reaction, so that was very good. So they're equal, round, they react to light. I'm going to have you look across the room, and then I would like you to look at my finger quickly. Very good, and they accommodate. So when you look across the room, your pupils dilate to let more light in, and when I bring my finger close, they constrict to shut some of the light out. So your pupils are reacting appropriately.
6 cardinal positions of gaze.
Very good. So I'm going to just hold my finger here, and what I would like you to do is keep your head and neck steady, and I want you to follow my fingers with just your eyes. So we're going to go up this way And I'm moving my hand very slowly so that I can see if your eyes are oscillating or have any abnormal vesiculations. And they do not. Your eyes are moving very steadily, so you don't have any symptoms of muscle weakness or nystagmus.
Inspect nose and sinuses.
Very good. So I'm going to have you remove your mask again. And I would like you to just tilt your head backwards, and I'm just going to take a look in each nostril. And everything is clear. I don't see any abnormal foreign bodies or any lesions of any type. Have you had any problems with colds or allergies here recently? Okay, very good. So I'm going to go ahead and just palpate your sinuses here. If you can look up, I'm going to check your frontal sinuses, which are right below your eyebrows. Any pain there?
Mm-mm.
Very good. And I'm just going to pull this down. And I'm going to check your maxillary sinuses as well, just putting pressure here below the eyes. Any pain there?
Mm-mm.
Very good.
Hearing test. Whisper.
Okay, so I'm going to just check your hearing real quick. I'm going to have you just look across the room straight, and I'm going to whisper a couple of words, and I would just like you to repeat what I said.
Lord's Nursing School.
Very good. So I'm going to come on this side and do the same thing.
University of Toledo Medical Program.
Very good. So your hearing is good.
Inspect mouth and mucosa.
Very good. So I'm going to use my pen light here again. So what I would like you to do, I'm going to have you open your mouth so I can take a look in there. And it looks like the oral mucosa is all intact. Can you move your tongue to the right? Very good. And move your tongue to the left. Excellent. So there's no lesions under the tongue as well. I'm going to use the tongue depressor because I'm going to inspect a little bit further here to make sure everything is good. Do you see a dentist? Very good. And how often do you see the dentist?
A couple times a year.
Okay, very good. And I want you to stick your tongue out and then say
Ah.
and I'm just going to check. Say ah. Okay. And very good. Okay, and everything looks good inside your mouth.
Neck. Inspect, palpate thyroid, lymph nodes, range of motion.
Okay, very good. So I'm just going to take a look at your neck here, and I'm going to palpate your thyroid gland. Sometimes it can enlarge. Can you swallow for me? Excellent. Okay, so I'm just assessing the muscles here to make sure that they feel firm and intact, and I'm also going to check your lymph nodes. Lymph nodes are part of the body's immune system, and they can enlarge or swell if you have any type of infectious process going on, and everything feels good there. So I'm going to check the range of motion of your neck. So I want you to go ahead and tilt your head down so that your chin touches your chest, and then I want you to bring your head up and tilt it backwards as far as you can go. Excellent. So bring it back to normal position. I'm going to have you look over your right shoulder as far as you can, and look over your left shoulder as well. And then what I would like you to do is to tilt your head to the side like you're trying to touch your ear to each shoulder. Very good. Excellent. So I'm also going to have you turn your face towards my hand to check the muscles of the neck, which are the sternocleidomastoid muscles.
Upper extremities. Assess for symmetry, palpate muscles and joints, range of motion, strength and range of motion of elbows, wrists, fingers, shoulders.
Okay, so I already assessed the skin of your upper extremities, and I did palpate the muscles, and everything seemed nice and symmetrical and intact. So I'm going to have you stand up for just a moment, and what I would like you to do is I'm going to put your shoulders through some range of motion. So I would like you to bring them up above your head. Good. And then just bring them down, and I want you to reach one arm across the opposite shoulder and bring it back. And I'm going to have you reach your other arm across the other shoulder. Very good. And then we're going to make sure that your shoulder is able to rotate appropriately. So I'm going to have you bring your hands up and put them behind your head. Very good. And then I'm going to have you bring them out and put your hands behind your back. Excellent. Good. So go ahead and bring your arms out, and I'm going to push down on them, and I want you to resist me. Very good. And I'm going to push up. I want you to resist me as well. Very good. So you have appropriate muscle strength graded at a 5, which is normal. I would also like to check this strength, and this is checking your trapezius muscle. So if you could shrug your shoulders up against my hands, perfect. All right, so I'm going to check your elbows, okay? And there isn't any swelling. The joints are not inflamed. They don't have any fluid on that side or this side. Excellent. So what I would like you to do is bring your arms up this way. So that is flexing your elbow, and I would like you to extend it as well. And then what I would like you to do is put your hands on your hips, because that shows rotation of the elbows as well.
Wrists.
All right, so what I'm going to do now is I'm going to check your wrists. Is there any pain as I'm palpating or checking any of this? Very good. So we aren't having any inflammation. There isn't any swelling. It doesn't appear to be painful when I'm touching. So I would like you to flex your wrists up. Very good. And extend them down. And then can you rotate them both ways? Excellent.
Hands.
Hands. Okay, so I'm looking at your hands, and there doesn't seem to be any swelling or lesions. Can you open your fingers all the way up and then bring them in together? I'm going to cross my hands, and I would like you to squeeze them as hard as you can. And I'm going to pull you forward. I want you to try to resist me, okay? Excellent. You're very strong.
Open and close fist.
And we're going to look at your fists here as well. So hands all the way open, and then close them as well. Very good. So you can go ahead and have a seat.
Assess sensation bilaterally upper extremities.
Okay, so what I would like you to do is to close your eyes, and we're just going to make sure that you can feel everything appropriately. So what I'm going to do is I'm going to touch your arm with some different objects, and I would like you to tell me what you feel and where you're feeling it. Okay, so eyes are closed, and can you feel this?
Yes.
Where are you feeling it?
My left upper arm,
And what does it feel like?
sharp.
Very good. How about this one?
My right forearm, and it's sharp.
Very good. How about this?
It's my right upper arm, and your hand's cold.
It's actually a key, but that's okay.
Oh, okay.
And then how about this?
My left forearm, and it's blunt. I guess.
Blunt? Okay, very good. No, your sensations are completely intact there.
Palpate brachial, radial, ulnar pulses, and grade.
Very good. So I'm just going to check your pulses, and that indicates if you have good blood flow in your extremities. And right here I'm finding it, and it's a 2+, which is normal. It means that there is good blood flow there. This is your radial pulse, and it's nice and strong, a 2+ as well. And this is your ulnar. This one is harder to find sometimes. And I am getting a sensation there. These, it's more of a 1+, but I'm not seeing any cyanosis. You've got some very good capillary refill, less than 2 seconds. So I'm not worried about feeling the same grade of that pulse there, because it's commonly more difficult to feel. We're just going to do the same thing on this side as well. That's a 2+. Your radial is 2+. Your ulnar is about a 1+ as well. And again, you look like you're a little bit cold. Are you chilly?
Mm-hmm.
Okay. Good cap refill though. So
Assess for clubbing.
I'm going to take a look at your fingertips, and what I would like to do is I'm going to assess what's called a profile sign. So I'm looking at the horizontal view of your finger, and I'm looking at the nail bed, and it's about 160 degrees as far as an angle there, which means that there is no profile sign and there is no clubbing of your fingers. So that can occur with patients who have chronic hypoxic states or problems with the lung system. So everything looks healthy and normal there.
posterior and lateral thorax.
All right, so I'm gonna just move around. Actually, I'm gonna move around behind you here around the bed. And I'm just going to look at your backside here, assessing your lungs and your thoracic cage. So I'm looking at the posterior thorax, and the skin is pink. Your shoulders are in alignment. Your spine is midline as well. Do you have any pain as I'm moving and pressing along your spine?
No.
Very good.
Skin color and condition, ease of breathing, respiratory rate, shape configuration, symmetry, spine alignment, thoracic expansion.
Okay, so you're breathing very easily. It doesn't look like you have any shortness of breath. I'm going to assess what's called thoracic expansion. So I'm going to have you go ahead and stand up. Sorry to make you move around so much. I'm going to have you turn it this way. And I'm just going to lift your shirt up here to expose your lower back. And I'm going to put my thumbs on the side of your lower spine. And what I would like you to do is take a deep breath in. Very good. And then let it out, please. Very good. So that's called thoracic expansion, and that means that your lungs are expanding normally and equally on both sides. Can I still have you stand here so I can just take a good listen to your lungs? Oh, I'm going to move your hair here. So I'm going to listen in all the appropriate areas. I'm going to start above the clavicles, because that's where the top or the apices of your lungs lay. So I want you to take some big deep breaths in and out of your mouth. When you breathe in and out of your mouth, I can hear those breath sounds a lot more clearly. So deep breath in. Good. Same thing over here. Excellent. And I'm going to move here. Big breath. And if you're getting tired or short of breath, please let me know. Good. Good. And I'm just moving around side to side to make sure both sides sound equal. And I'm going to listen here below your costal angle. So big deep breath in again. And breathe out again. And I'm going to move to the right side here, kind of in your axillary area, because the right lung middle lobe lays here. So big breath. And one more. Very good. So your lungs are clear. I don't hear any abnormal sounds. Everything looks good on assessment there. Okay. So the other thing I want to do is check your what's called an AP to lateral diameter. Okay, so I'm going to have you just kind of put your arm up beside you, and what I'm doing is I'm measuring the anterior and posterior width of your thoracic cage, and then what I would like you to do is just kind of rotate towards the wall over there. Okay, and this should be about 1/2 to 1/3 of your lateral thoracic cage, and it is. So you don't have any barreling of the chest, which means that you are eliminating all of your carbon dioxide. You're not retaining any air when you're breathing, so that's good. Go ahead and sit down for me. All right, so now I'm going to examine the anterior thorax. So same thing, I'm looking at the skin. You're still breathing very easily, even though you took a bunch of deep breaths for me. And I'm going to go ahead and just auscultate in the same manner. So I'm going to listen above the clavicles. Big deep breath in and out of your mouth. Good. And same thing over here. Very good. Good. And I'm just going to kind of come in here under your shirt. I'm sorry if that makes you uncomfortable, but we have to listen right on the skin so we can hear all appropriate sounds. Deep breath in. One more time. Excellent. And I'm going to come on this side as well so I can hear the anterior portion. I'm moving your shirts around a little bit so that they don't make extra noises on my stethoscope. Big breath. And one more time. Very good. And everything is nice and clear there. Okay.
Neck, assess for JVD with the head of the bed at 45 degrees.
All right, so I'm gonna let you get comfortable now. So are you nice and comfortable in the bed there? Mm-hmm. Good. I'm gonna go ahead and just put the head of the bed up here. So what I'm doing is I'm just kind of looking at your neck here, making sure that the veins in your neck, they're called jugular veins, that they are not distended. And they are not. So that means that the right side of your heart is not retaining fluid and backing it up into the body. So it's a sign of very healthy vasculature in the neck.
Carotid artery, palpate pulse one at a time, auscultate for bruits bilaterally.
Okay, very good. So I'm going to check your carotid pulse. So this is an assessment of the carotid artery, which is, it supplies the blood flow to the brain, so it's really important that we get a good pulse there. And I'm going to listen to it for any bruits to make sure that there isn't any narrowing in there. Sometimes if we have plaque or narrowing in the carotid arteries, it'll make a sound for us. It's called a bruit. Very good. I'm going to have you turn your head the other way. Can I have you just hold your breath for a second? Very good. All right, go ahead and relax. Sometimes when you're breathing, I can't hear everything appropriately because it's magnified with the stethoscope.
Heart, inspect precordium for lift, heave, pulsations.
All right, so I'm just kind of looking at your chest where the heart lays. And I'm going to go ahead and touch your chest and all the areas where the valves of the heart lay, just to make sure that I'm not feeling any effects of any turbulent blood flow that might be going through there. Okay, so I'm going to go at the second intercostal space here on the right sternal border, check in at the apical, or the aortic valve, and then the pulmonic valve. And again, I'm going to kind of come in here under your shirt to check the Erb's point. And then I'm going to come up under this way. Would you like a blanket or anything to be covered a little bit?
I'll be all right. Thank you.
You'll be all right?
Yeah.
Okay, very good. So
Thank
I'm
you
just
for
checking.
offering.
You're welcome. The tricuspid valve here, and then the mitral valve. Excellent. So I don't feel any abnormal pulsations, and I'm going to listen to those areas as well. So I'm going to listen with my diaphragm first, because that tells me higher pitch sounds. Come under here again. Good. And then I'm just going to listen with the other side of my stethoscope, because sometimes that's better at picking up murmurs because it picks up lower sounds. Very good. Very good. So I'm also going to listen here. I'm going to feel real good at the mitral valve, because that's what we call PMI, or point of maximal impulse. And I can feel a really good pulse there. It's nice and regular. And I'm just going to compare it to your radial pulse as well. I'm sorry, hopefully this is the last time that I'm invading your space. And they're nice and equal. So no problems there at all. Excellent.
Assess apical pulse and rhythm. Listen for 1 full minute. For the purpose of this video, this has been done. Assess for apical and radial pulse deficit.
I just did that.
Abdomen. Inspect contour and symmetry.
Very good. So I'm going to go ahead and put the bed all the way down and let you relax for a little bit. You doing okay?
Yes.
Excellent. Okay. So I'm looking from the side here, just assessing the contour of your abdomen, and it's nice and flat. I'm looking at your skin, and you don't seem to have any abnormal lesions or abnormal vascularities. Your belly button is inverted, like we want to see it. It's nice and midline. I don't see any abnormal pulsations there as well. So I'm going to go ahead and I'm going to listen in all 4 areas of your belly. I'm just listening for gurgling for vowel sounds. And you are nice and gurgly. I think you're hungry. Excellent. So I looked at it and then I listened to it first. So now I'm going to go ahead and I'm just going to just do some light palpation to see if I can feel any superficial masses or irregularities, abnormalities. If anything hurts, please let me know. And I'm just going to try to cover all areas of the abdomen to make sure I'm not missing anything. Is anything hurting in there at all? No, good. Good, no problems there. Abdomen looks, sounds, and feels great.
Lower extremities, assess for symmetry, range of motion, and strength. Begin with the hips.
All right, very good. So I'm just going to go ahead and take a look at your legs. Right now the skin is nice and pink. And it's warm. I've already looked. I didn't see any abnormal lesions, and there wasn't any edema there. So I'm going to go ahead and check your hips. So what I would like you to do is lift your leg, lift one leg up. Very good. And I want you to cross it over and lay it straight on this one. Excellent. I'm going to have you lift it up again, and I'm going to have you bend at the knee. And I'm going to rotate it. So I want to make sure that your hip will go this way. Excellent. Does that hurt? No? Good. And we're going to bring it this way as well. Excellent. Okay. So we're going to do the same thing on this side. Can you raise your leg up? Good. And go ahead and cross it over this way. Excellent. And bring it back. And you can just set it down. And we're going to rotate your knee inward. And I'm going to rotate your knee outward. Excellent. All right. Can you lift your leg up against my hand? Excellent. And same thing over here. Very good.
Knees.
Okay. So with your knee, I totally forgot. I'm going to have you sit up. I'm going to check your knees here. So I'm going to have you sit up, and I'm going to have you bring your legs over to the side there. And I'm just going to feel them here to make sure that there's no swelling or anything. And what I would like you to do is I would like you to straighten your knee and bring it down. Same thing here. Straighten and bring it down. And I would like you to push out against my hands. Ooh, and then try to pull me towards you. Very good.
Ankles.
And I'm going to check your ankles here. I'm checking for your pulses here as well. I'm checking the medial malleolus, and I'm checking your dorsalis pedis as well. And those are 2+. And I'm going to check for caprifel here. Your toes are a little cold, so it's but they do have good caprifel, less than 2 seconds. I would like you to point your toes down. Good. And then I would like you to point them up. Excellent. And then can you curl your toes? Excellent. And then open them all the way up. Very good. So I'm going to check your pulses over here as well. So behind the posterior aspect of the medial ankle. Good. And the dorsalis pedis on the top of your foot. And those are 2+ and strong, which is good. And I'm checking the caprifel, and it's less than 2 seconds. So I would like you to point your toes down. Excellent. And push them up as well. So, bend your ankle up. Very good. And then curl your toes, and then straighten them out. Excellent. Very good.
Inspect for edema.
And I'm just going to push on these legs here again, since we moved around a little bit, to make sure that there isn't any edema in the front portion of your legs. We call that pretibial. I'm also going to check around the ankles because fluids can accumulate there as well, and on the top of your feet. So if you had edema, when I pushed in, it would leave an imprint of my hand, but nothing stays imprinted on you, so you don't have any fluid accumulating on your lower extremities.
Closure. Thank patient for their time.
All right, so that completes our head to toe physical. Do you have any questions or concerns about anything? No, very good. So thank you so much for your time. I'm going to go ahead and document my results. I'm going to call the physician and just let them know that everything was normal. I don't have any concerns about the findings that I had on your physical. I think you're nice and healthy, but if you have any future concerns or problems, please call your healthcare provider as soon as possible. So,
Return bed to lowest position, side rails up ×2, call light within reach.
excellent. So I'm just going to put your side rails up here to keep you safe, and I'm going to give you your call light. So we have some new call lights here. I would like you to just press this, and that will call us if you need us. And I'll be back in about a half hour or so to check on you, see how things are going.
Okay, thank
All right,
you.
have a great day.
You too.